Okay, so now we're ready to discharge our patient. We have appointments set up for his TB reading, so he will need to see the doctor about that. Of course, he will be having to have some labs done. Those will be set up as well. Hi, my name is Rhiannon and I'm from Highland Community College. I have my instructor here with me. It looks like you are ready to go home. However, I would like to educate you a little bit on your medications, if that's okay. Okay, can I please see your, can you please tell me your name and your date of birth? Okay, and then I would check it with MR. Okay. So your furosemide, your pantoprazole, and your insulin you get right before breakfast. Make sure that you have your breakfast available when you have your insulin injection. You're going to want to alternate your sites. The sites that you do use, make sure that you go back to make sure that they're not infected. It's okay to use the back side of your arm, your abdomen, just stay 2 inches away from the belly button. You can use your thigh. And if you're going to draw up the insulins together in one needle, just make sure you pull back enough air and put the air into the NPH one first, and then the 5 mils, and then 5 mils into your regular. So you're going to want to drop your regular first. Make sure that your NPH vial is cloudy. You only want to use the insulin for about 30 days, and then it needs to be discarded. Check your blood sugars regularly. For your furosemide, you're going to want to watch how much you're urinating, and make sure you take that in the morning because it will make you urinate and you don't want to be up all night going to the bathroom. Make sure you take fluids in. You're going to end up flushing a lot of that out, so you don't want to have an electrolyte imbalance. With this, you're also going to change your position slowly. When you go to stand, go slow. Don't operate a vehicle until you know what the medicine does to your body. Take your medicine as prescribed. If you have a weight gain or a weight loss of 2 pounds in a day, you do need to call the physician. So if you end up having any kind of muscle weakness, unexplained muscle weakness, cramps, dizziness, dry mouth, visual changes, you should call the doctor. So your pantoprazole will help you with your GERD or your indigestion. You would just take that in the morning as well with your insulin and your furosemide. Once again, you would watch for your muscle weakness, irregular heart rate. Your insulin, like I said, make sure you have your breakfast available 10 to 15 minutes after the injection. Some signs and symptoms of hypoglycemia is tremors, cool skin, clammy, altered mental abilities. The other one is hyperglycemia. This may make you tachycardic and this also may make you shake and agitated. So if you have any of those symptoms, check your blood sugar and call the doctor. You should also wear an ID bracelet too, so that way they know your type for your Metoprolol, remember you're going to want to assess your pulse. So you're going to check your wrist, and you're going to go right on the inside here, and you're going to count for a full minute. You're going to check to see if it's regular, and if it's below 60, you do not want to take that medicine. And then you will need to call the doctor as soon as possible. You will also want to take your blood pressure. You can get a manual cuff at Snyder's, or the fire station can even do it. If your blood pressure is below, or your systolic, which is your top number, is below 90, you should also call the doctor and do not take that medication. If you go to a dentist or have any kind of procedures, make sure you do tell the doctor that you are on that medication. There's always that risk for bleeding and complications. There may be a risk of you having hypotension, which is low blood pressure, so it's still very important to take your blood pressure. Rise slowly. Your digoxin. Once again, check your pulse on your wrist. Check for irregularities. Once again, if it's below 60 beats per minute or over 110, you need to hold that and call the doctor. You will have appointments set up because you're going to need your labs drawn for digoxicity, which means we need to check your drug levels of the digoxin. We're also going to keep we're going to do labs on your kidneys because a lot of your medicines deal with your kidneys, and we need to make sure that you're secreting it right and absorbing what you need to. Also, your electrolytes. A lot of those medications will play a part in the electrolytes, and we do not want to throw you into an imbalance. Your TB, we've set up an appointment. In 48 hours, you will have that read. You will need to see your doctor. They're just going to look at it and touch it. If it's positive, they will do some further testing. It just means that you've been in contact with the mycobacterial or the tuberculosis. Have you traveled outside the state at all? Or outside of the country? Been around anybody? The flu shot, remember, you need to move the arm so it does not get stiff and sore. People tend to kind of baby it. So if you keep putting it through range of motion, it won't get as sore and stiff. Like I said, if you have any questions or concerns, such as like visual changes, dry mouth, dizziness, you can't regulate your blood sugars, you've noticed that your edema is back and is pitting, you need to give us a call. Remember to keep an eye on your weight, take it first thing in the morning before you eat. Blood pressures and pulse. All right. And your simvastatin, you will be taking tonight. You will take that before bedtime. That is for your cholesterol. We take that at night because it works better at night. Your body is at rest. You will probably have your lipids drawn too, to keep an eye on that to see if it needs to be altered, the dosage needs to be altered, or if we need to put you on a different kind of medication. Any questions, concerns? All right, thank you, Mr. Truman. Do hand hygiene. He has his call light, the bed's locked, the bed's down. He is safe. I'm going to exit.